right.
Okay. Well, good morning. We'll go ahead and get started with today's press conference. Today, we have 302 new positive cases for a total of 7,145 positive cases in Iowa. 89%, almost 90% of today's positive cases are from 22 counties where restrictions will remain in place. 198 of the 302 new positive cases are from Black Hawk, Dallas, and Polk counties. I am sorry to report that this morning we have had an additional 14 Iowans that have passed away due to COVID-19. Today, we had 1,028 new negative cases for a total of 35,552. 42,667 total tests have been conducted in Iowa for a per capita rate of 1 in 74 Iowans have been tested. 2,697 Iowans have recovered from COVID-19 for a recovery rate of 38%. Beginning tomorrow, restrictions that were put in place to slow the spread of COVID-19 will begin to be eased in counties where virus activity is low or where there is none at all. Iowans in many communities will have an opportunity to shop on Main Street, eat at their favorite local restaurant, or attend church on Sunday if they choose. These first steps are welcome signs that life will eventually get back to normal. But we should expect normal to look a little different and look and feel a little different for a while. COVID-19 isn't going anywhere anytime soon. The virus will continue to be in our communities, and unfortunately, people will still get sick until a vaccine is available. Keeping businesses closed for weeks or months longer won't change that fact, and it simply is not sustainable. It's not sustainable for Iowans, their livelihoods, or our economy. We must all learn how to manage the virus in the course of our daily lives. Iowa's expanded testing, case investigation, and tracing capabilities gives us the tools necessary to identify and isolate positive cases, track virus activity across the state, and deploy targeted strategies to continue and manage it for the long term. This enables us to take a very measured and phased-in approach to Iowa's comeback. I believe that we can begin to get life and business back to normal in a safe and responsible way if we all continue to work together and to do our part. My team and I remain committed to doing what's best for Iowa's collective health. Data will continue to drive our decisions as it has from the start. And as we see virus activity stabilize and trend downward, we'll know when and where we can continue to ease restrictions, and we'll do so in a thoughtful and responsible way. And we'll continue to educate Iowans about the risk and ask you to continue to practice personal responsibility so together we can mitigate the spread of the virus as we continue to move forward. I want Iowans to know that your health and safety and livelihoods are our highest priority. I also want you to know that I'm confident Iowans will continue to do the right thing to protect their health and the health of others. As businesses start to reopen and you begin to interact in public again, it's just as important that you continue to take all steps necessary to prevent exposing yourself and others to the virus. We know that COVID-19 spreads quickly and easily when people are in close proximity, which is why social distancing continues to be extremely important. Whether you're out in public or just outside in your own neighborhood, please continue to stay at least 6 feet between yourself and others. Careful hygiene is also a simple but highly effective way to reduce your risk of getting the virus. Wash your hands, cover your cough, and disinfect commonly used items frequently. Remember that most people who get COVID-19, about 80%, will experience mild or moderate symptoms and may not even require any medical attention at all. But for the 20% of Iowans who are at the highest risk of severe illness, COVID-19 has proven to be life-threatening. Older Iowans above the age of 65 and anyone with pre-existing health conditions, should continue to stay home as much as possible and take additional precautions when you have to go out. Again, we all have a role to play to protect our most vulnerable Iowans. Limiting your time away from home also limits the chance that you'll be exposed to the virus. And if you're experiencing any signs of illness, even mild symptoms, stay home. Call your doctor first to see if you need medical attention, and take the assessment at testiowa.com to see if you qualify for testing. While things are beginning to change in our state, what hasn't changed is the need to take, again, personal responsibility to slow the spread of the virus so that we can manage and continue to move forward. As some businesses are preparing to reopen tomorrow, many Iowans are also heading back to work. Today, I've asked Iowa Workforce Development Director Townsend to share information about our state's unemployment claims and what Iowans should know about their benefits if their employment status is changing. Director Townsend?
Thank you, Governor Reynolds. First, I'll share the number of initial claims that were filed this last week. Were 28,827. The number of continuing weekly claims was 170,990, and a total of $51,408,623 were paid in those benefits. This week, a total of $102,714,000 were paid in federal pandemic unemployment compensation benefits to over 153,000 Iowans. Since April 4th, we have paid over $327 million in FPUC payments. A total of $4,810,592 was paid to 13,334 Iowans receiving pandemic unemployment assistance benefits, which are the benefits that are paid to those who are not normally qualified for unemployment. Today, IWD has implemented a change to our phone system so that when you call the 1-866-239-0843 number, after you make your menu selections, you will begin to hear music rather than ringing in silence. You will hear the music until your call is answered. We hope that this will make it easier for people to know their call is in queue and to stop individuals from repeatedly calling and hanging up. Please just remain on the line and your phone will be answered, or your call will be answered. I also wanted to address the situation the governor just referenced regarding individuals who are being recalled to work. We want to remind all individuals that if you are recalled to work and choose not to return, you may lose eligibility for unemployment benefits in addition to losing your job. As we indicated, there are a few virus-related exceptions, including if you are diagnosed with COVID-19 or are experiencing symptoms, if a member of your household has been diagnosed with COVID-19, or you are caring for an individual in your household with COVID-19. You or a member of your household are in a higher risk category and have been advised by your healthcare provider to self-quarantine due to concerns related to COVID-19. You lack necessary child care related to COVID-19. You cannot reach your place of employment because of the outbreak, or you have had COVID-19, have recovered, but it caused complications rendering you objectively unable to perform the essential functions of your job. Additionally, if you are, for medical or age reasons, in the high-risk category, you might qualify for the PUA benefits. We strongly encourage all Iowans to talk with their employers prior to their return to work to understand the measures they are taking to ensure the safety of their employees and customers. We do have a provision in our unemployment code that allows an individual to quit a job if they feel that their workplace is unsafe. However, it takes more than a mere assertion by the employee to establish this to be true. If an employer establishes that they have taken the necessary steps, such as following industry standards established by OSHA guidelines, providing extra wash stations, additional sanitation areas, allowing or providing PPE, such as masks or gloves, and following appropriate social distancing recommendations, it may be difficult to establish a good faith basis to quit due to safety concerns. As we have heard from the Restaurant Association, industries across Iowa are adding even more cleaning and sanitizing efforts above and beyond what they normally do in order to ensure the safety of their employees. We know employers have always had strong motivations to create the safest working place possible, and they are taking those necessary and additional steps to prevent the spread of the virus in their workforce. They have the same motivation as their employees to remain healthy and to prevent the spread of the disease. And when their efforts are combined with our personal responsibility to wash our hands, maintain social distancing, covering our coughs, and staying home if we feel ill, we can increase the speed of our recovery by getting people back to work in a safe and healthy environment.
Thank you, Beth. And again, I want to thank you and your team for all that you've done to support so many Iowans during this challenging time. You and your team have done and continue to do a remarkable job. Finally, Iowa small business owners have carried a heavy burden during these past several weeks, as many have had to close their doors and let employees go. I'm proud of the work that the Department of Revenue and the Iowa Economic Development Authority have done to support them during this challenging time through the Small Business Relief Program. I am pleased to have Iowa Economic Development Authority Director Durham with me today to provide an update to Iowans about the program. Debbie?
Well, good morning, and thank you, Governor. Well, last month, Governor Reynolds challenged my team with creating a small business relief program that would provide critical short-term assistance for our small businesses economically impacted by the COVID-19 public health emergency. On March 23rd, I was at this very spot as Governor Reynolds launched the Iowa Small Business Relief Grant Program with $4 million available for allocation. I want you to note that 11 business days after the program was announced, I was here again as we announced an overwhelming response to the program. Due to this incredible need for assistance, we were able to increase funding for the program to $24 million to assist more than 1,200 business owners. I'm proud to say that 18 business days after we started drafting the program from the ground up, businesses were among the first to close their doors, had some stopgap short-term relief in their mailboxes. The program was developed rapidly to provide rapid relief to small business owners because we know that every day that goes by right now is a critical one for so many Iowans. As of today, a total of more than 2,600 restaurants, breweries, florists, salons, boutiques, gyms, and a wide array of other small businesses that line the streets of communities in all 99 counties have been awarded small business relief grants for a total of approximately $50 million. We have several thousand additional eligible businesses remaining in the applicant pool, and we are working very closely with the governor to be able to assist as many of them as possible in reopening stronger than ever. We continue to make award notifications on an ongoing basis. A listing of grant recipients is available at iowabusinessrecovery.com, and it is updated daily. I can tell you that the spirit of our business owners remains resilient, strong, and hopeful for tomorrow. Our team is fueled from the notes that have been pouring in from all over our state, from businesses that are telling us that they are hanging on and will see us upon their reopening. Among the latest batch, you will find a brewery in Bittendorf, a print shop in Britt, and a gym in Cedar Falls. This week in my inbox, I received a note from Kaylin Henderson, owner of the Airport Road Vineyard and Winery Event Center in Mount Pleasant, that I want to share with you. Like many small business owners, we've poured our hearts and dreams into our little slice of heaven that is our vineyard and event center in rural Iowa. The fear of the unknown and wondering what is going to happen is agonizing, to say the least. When I received the grant notification, it brought out all of the emotions. It's a relief, as the financial assistance will help us in the short term. And it is also hope, which we so desperately needed. We can't thank you enough and hope you will stop by when we are once again open for business. In closing, I want to thank Governor Reynolds for her continued and measured leadership and support for small businesses as we prepare to reopen Iowa for business stronger than ever. Thank you.
Thank you, Debbie. And I also want to just heartfelt thank you to you and your team. I know this has been a huge effort in a really short amount of time, and it has made a significant impact on our small businesses across the state. And as I mentioned earlier, COVID-19 is here to stay, and we must learn to live with it. For now, doing something as normal as going to the store or going out for dinner may seem foreign to us. You might even feel apprehensive about it. Each of us will need to make the choice that's right for ourselves and our families. And that includes business owners who may not be ready yet to open their doors. And that's okay. These are unprecedented times, and we're all learning how to manage COVID-19 for the long term. As we have been since the beginning, we continue to say we're all in this together, and I have no doubt that Iowans will continue to rise to the occasion, work together, and do the right thing. Tomorrow is a step forward for our state, so let's continue to be safe and responsible as we navigate the path ahead. And with that, I'll open it up for questions.
So a question about the testing that we've been using with Test Iowa.
Yep.
What were you told about the accuracy of the tests that they're using before they brought them in terms of what were the statistics you were aware of the accuracy of those tests? And are you confident that they're showing a clear picture of the people being tested?
So we are in the process right now of validating the process. Test Iowa is located at our state hygienic lab. I think Test Utah is located at a regional hospital. We decided to bring ours into the state hygienic lab through the University of Iowa. So we have the PCR testing in one area, and then we have the Test Iowa in another one. So Dr. Pandela and his team is taking all precautions necessary through the validation process to make sure that we can assure Iowans that the results that we are getting are accurate and what they should be. In addition to that, Utah is testing right now. They've opened it up to anyone that wants to test. We're still keeping ours very narrow so that they are testing anybody that wants to have a test. Hopefully at some point we'll get there, but we are still in the validation process with the Iowa State Hygienic Lab and Dr. Pandela and his team.
So does that mean you're not sure that the tests are accurate? Because
No, we are, but we're going to validate that at the State Hygienic Lab. And there's a process that they go through. They're CLIA certified, so they have to make sure that they make the, that they hit the criteria. And we're in the process of doing that, and we'll be able to report that out once they're complete with the validation. So they'll be able to test both.
So it sounds like one of the concerns was that this test requires a higher amount of virus in a sample than what the CDC would recommend. So have you checked those things out to make sure that these tests are going to be compatible to what you might get if you were taking a test from some other vendor?
And they would have to be, because they were FDA approved, so they have gone through the process, or they wouldn't have been able to be opened up and utilized in Utah. So they have gone through the process. They'll continue to look at what some of the positivity questions are. In the meantime, as we're going through our validation process based on the requirements that are put in place so that we can assure Iowans that the tests that we are relaying to Iowans are accurate and providing the information that we expect. And so as we get done, then possibly what we can do is bring, Dr. Pandela or somebody from the team or the Department of Public Health can report out the process that they went through. But I can assure you, because we're on the phone with them every day, that they're taking every measure and taking every step that they can to make sure that they're doing the validation process accurately and that they can feel confident in the results that they're reporting out to Iowans. And that's, I'm proud to have it at the State Hygienic Lab for that reason as well.
When will the state release counting numbers that show positive tests, negative tests, total tests every day like it does for the state?
We do. Don't we daily show positive county data?
Where you can get on the website and look at each individual county.
I think you can, right? I've looked at so many sites, but we'll...
Yeah, there's a visualization, there's a data visualization on coronavirus.iowa.gov that shows 24-hour case counts and then total counts by county. Is that not your question?
Could be.
Okay. So I think, Dave, it shows like right now, but we're going to make an announcement later this week and Monday, so we're going to continue to enhance. And we've gone through various iterations as we've utilized technology, as we've been able to gather more data to make sure that we're trying to be as transparent as we can with Iowans. And so right now, I think if you go to coronavirus.iowa.gov, you see the number of cases, you see the number of deaths, you see the number of recovered that is also listed, and then you can show, if you drill down into the different areas, it shows how many new cases. Not new, okay.
No, Governor, you're right. So,
Okay.
so there's a map, and if you click on the map, you can see the total number of tests per county and the total number of positive tests per county. So you have to do a little bit of math to figure out the negative tests by county currently, and that's what the governor is foreshadowing, that I think we're going to move to a new visualization here that'll be able to show positives and negatives and include that negative information. But it is available right now. You just have to do a little bit of math. And then the positive case counts by county are available, both cumulatively as well as on a 24-hour basis.
Okay. So I've been looking at the other test sites. So that's some of my confusion because I've been working in test sites in both. So we hope to even continue to make that easier for Iowans.
Are Sioux City hospitals sending patients to Omaha hospitals because of the increase in Woodbury County?
I don't believe they are, but they have been working in the region and with the surrounding states. All of them have been working together to make sure just that they have a surge plan in place, that we make sure that we have adequate resources, that we have the number of beds, the number of ICU beds that we need, the number of vents that are available. They also are part of larger affiliations in the Des Moines area that have been working with the hospitals as well. And so that's, some of the planning and the preparation that's been going on since we started with the pandemic to make sure that we're prepared and ready. There still, could be some possible bumps and all of that, but they've done kind of an unprecedented coordination and collaboration between the hospitals, between the critical access hospitals, some of our larger hospitals in Sioux City with their hospitals back in the Des Moines area to really walk through how we prepare and are ready and to anticipate any type of a surge that we might see. So, and that area the Siouxland area has always worked very well and very collaboratively with Nebraska and South Dakota as well. So those conversations are also taking place to see how we can coordinate that as well.
Chris, KCCI.
Hi there, Governor, and perhaps Beth too. We've heard from many viewers who say they have to care for a vulnerable loved one, but they also have to provide for them financially, and they're afraid to go back to work and bring something back, but they're also afraid of being booted off unemployment and being unable to provide for their loved one. What's your advice to Iowans who feel like they're forced into making a deleterious choice either way?
Yeah. Well, Director Townsend gave a pretty significant list of exceptions that address, I believe, the situation that you just listed. But I'm going to let Beth kind of walk through again what some of those are.
Yeah, Chris, so if you are taking care of a member of your family or live in your household that has been diagnosed with COVID-19, then you would still qualify for PUA claims. You would just need to let your employer know that you're unable to return to work because of the care you need to provide for a sick family member. Work with your employer to keep them informed and the medical provider of the family member. And obviously, your employer would let you know what kind of documentation they would need to provide you a release to return to work. But in the meantime, you would still qualify for PUA benefits, that pandemic unemployment assistant benefits, plus you would still qualify for the FPUC benefits, which are the federal pandemic unemployment compensation benefits, that $600 weekly benefit. So you're not going to be in a position, if you're caring for a sick family member, where you have to sacrifice your job or your benefits.
What if they're not confirmed to have COVID-19, but they're just someone who, your family member is in a high-risk category, and you're worried about bringing the virus home?
Again, that is something you would need to work with your employer and the doctor of your family member regarding what kind of medical risk there would be, where you work, what kind of environment you would be working or being asked to work in. But you can work through those situations with your employer. If it's determined by the medical provider that you should not be returning to your home from outside, whether it's going to do anything or your place of employment, then you would qualify for those PUA benefits and those FPUC benefits as well.
Tony, Des Moines Register.
I think one of the things too, we've asked, employers to take a look at if you have a vulnerable person in your household to make all reasonable opportunities for your employee to be isolated from the rest of the workforce too. So, they also are trying to do whatever they can to be accommodating, is the word that I was looking for, to their worker to accommodate those isolated circumstances.
Tony, go ahead.
Governor, I'm going to circle back to the questions being raised in Utah about the accuracy of the test.
Mm-hmm.
Do those concerns in the story in the Salt Lake Tribune worry you? Are you concerned about them?
Well, I just found out about that story a couple minutes ago, but that's why, again, as I said, we have the Test Iowa located at the State Hygienic Lab. We're working with a team that's very qualified that have been doing the PCR, the serology testing for a long, long time. There's a lot of expertise in that lab, and that's why they're taking the time that they are to make sure that they're validating the process so that we can assure Iowans that the results that are that they're receiving are accurate. And so they're in that process right now. We are still ramping up, and I feel confident that we'll be able to demonstrate that to Iowans.
We're going to go to Aaron, Lee News.
Thank you, Governor. Just curious, how soon will the state begin reporting results from those Test Iowa testing?
We have now, but running through the, yeah, do you know?
No, they're not.
Okay.
So we have a few of those results that have been included in our daily total so far. We're not going to be, at least at this point in time, I don't think there's an intention to break out Test Iowa positive results as opposed to other test results that are taken in other places. So the positive results from Test Iowa, they're just going to be reported just like our other positive results have been reported. They're going to be rolled into a total positive number every day, and they're not going to be separately reported as Test Iowa results versus all other results as we move forward.
Okay.
All right, we got time for two more questions. We're going to go to Beth at KCRG.
Good morning, Governor. Governor, since Tuesday, COVID ICU rates have increased 23% and patients needing mechanical ventilation increased by 34%. While, as you've illustrated, capacity is still in Iowa's healthcare system, do you have any insight as to what might be going on here, and do you have any response to these recent increases?
Well, we're still monitoring that, and we monitor it from a resource perspective to make sure that we still have available beds, ICU beds, vents, to really treat a surge in COVID patients. And so we are seeing somewhat of an uptick in Northwest Iowa, so we're monitoring that. We're also seeing discharges as well as we're seeing new patients move in. So it's kind of been a balance. We watch region by region as well as the overall state availability to vents and beds and ICU beds. And so we continue to monitor that and to work with our hospitals through the RMCCs, through the local public health, and through just the outreach with them to make sure that they're getting what they need.
All right, we're going to go to Caroline. Last question.
Good morning, Governor. My question is still related to the Test Iowa. The contract says that hydroxychloroquine should be issued as potential treatment to keep hospital beds low, but the FDA issued a warning about this last week saying it should not be used outside of a hospital setting. So wondering who put this treatment thing in the contract, and is it the formal advice of the Iowa Department of Public Health that hydroxychloroquine is a way to treat COVID-19?
No, and Iowa is not pursuing that at all. If a doctor or clinician advises that, then they can, but it's not something that the Department of Public Health or Iowa is pursuing as part of the Test Iowa initiative. So thank you for that question. Thank you.